Catching flu and COVID-19 at same time almost doubles risk of death.
Here's a summary of the article.
Professor Yvonne Doyle, the medical director at FAE, said, "People still think that the flu is just like a cold, it's not. Those who are going to get a bad dose of flu may well end up in hospital at a time when they may be exposed to other problems like COVID. If you get both, you are in some serious trouble, and the people who are most likely to get both these infections may be the very people who can least afford to in terms of their own immune system or the risks of serious outcomes." A typical flu season in the UK kills between 4 and 20,000 people. Last year, approximately 8,000 people died due to the seasonal virus, with around 5,000 hospitalised. FAE aims to vaccinate 75% of the eligible groups this year. 2 and 3-year-olds will be able to get a vaccine from their GP. Professor Jonathan Van Tam, England's Deputy Chief Medical Officer, said, "Flu can be deadly and it is easily spread in children and adults. The vaccine is the best way to protect yourself from becoming ill with the flu, especially if you are in a vulnerable group."
This post received a score of 14,000, with an upvote ratio of 96%. Here are the top comments in response to this article.
The good news is that with all the COVID preventions, the Southern Hemisphere has seen way reduced flu cases. When you fight something way more infectious than the flu gets left behind.
The good news is that everything is terrible, so dying isn't such a bad thing.
Except when you're responsible for someone who can't possibly take care of themselves and there's no one else to do it for you.
No problem, friend. My previous comment about dying is applicable to everyone.
This is blissfully brutal.
COVID-19. Prepare for trouble. Common flu. Make it double.
To protect the world from overpopulation, to spread mass death through every nation.
To denounce the evils of masks and gloves, to extend the spread to the stars above.
COVID, flu.
Team Corona blast off at the speed of light. Meowth. My health, my right.
Link without paywall.
Thanks for sharing. It's good to see that UK is taking action towards awareness and adjustments to vaccines campaigns, so that other countries do their own.
I'm not surprised at all. Both diseases have the potential to fuck your shit up alone.
Healthcare worker here. Pre-COVID, it was either flu shot, or wear a mask for 6 months. Now, over half my coworkers are saying what's the point of getting the flu shot if I have to wear a mask anyway. Sigh, man, sigh.
Healthcare worker here. Either get the flu shot or get fired. Our hospital literally gives you no choice.
If I've never gotten the flu shot in the past, would it be a good idea to take one now? Yes, please, everyone needs the flu shot this year. Healthcare worker.
I have a question. I am German and it's not super common here to get the flu shot every time. I would get the shot this year, but only if there are enough vaccines available. Is it possible that I would steal someone's shot because there are not enough for everyone? Shall I ask my doctor about that? The sick and elderly need them much more. If there are enough, I agree it would be the best thing to get the shot. Don't worry about stealing someone's vaccine. When there's a limited amount of vaccines, the health institutions take that into account and give them to those who needed it by level of priority: immunocompromised, pregnant women, elderly, etc. According to the established guidelines, they have epidemiologic estimates of each group in your country. So if you get access to the vaccine, it is because everyone else who needed it more than you has already been covered.
Flu and COVID-19 stack.
The debuffs are multiplicative.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.